Hello everyone, my name is Wendy Castellino and I'm a psychotherapist for over 30 years and use CBT techniques and Emdr techniques. Today I want to talk to you about Emdr and how effective it is as a therapy. So we do live in difficult circumstances, and so it's particularly important we talk about trauma and Emdr. It is a very effective therapy, and it's important to actually understand what trauma is. So I think about trauma as a distressing event, and it leaves the person with an unpleasant memory of that event. Now this could be simply an image of what's happened, but most likely the person will have a range of unpleasant symptoms that accompany that memory. These symptoms can vary in intensity, and depending on the event, they can be sensory, they can be sight, sounds, smells, sensations in the body. You can also have a range of symptoms if you actually have experienced trauma, and the most common name that is called trauma is called PTSD. You might have heard of the letters PTSD, but what does PTSD stand for? So it stands for post-traumatic stress disorder, and this is actually a formal diagnosis. It's often used by psychiatrists or other professionals such as clinical psychologists. And if you have PTSD, you suffer from a range of symptoms. The ones that actually are included in PTSD are things like a severe threat to their life, or a very severe injury, or witnessing either a death or a severe injury. Classic other symptoms can include things like flashbacks and nightmares, which can be terrible, can really affect people's sleep, and actually not being able to sleep can really affect the impact of people's day-to-day lives. You can have single PTSD and complex PTSD. The difference is that single PTSD tends to mean to one significant traumatic event, and complex PTSD tends to mean several traumatic events in your life. However, in my experience, many people may not meet the criteria of PTSD, but may still have distressing symptoms and unpleasant memories and experiences. They also might have similar symptoms such as nightmares, but they don't simply fit the criteria of PTSD. So actually having trauma, what effect does this have on people? Well, it can affect people in a number of ways. One example, there could be some confusion with their symptoms. They may have trauma symptoms, but they don't have an explanation or an understanding. So people might be very confused about what's wrong with them. To add to the situation, people can also have secondary problems such as anxiety or depression. So they might be diagnosed with these symptoms, anxiety and depression, but the underlying trauma might have been missed. This could happen for a number of reasons. For example, the person may not mention situations as they don't think they were significant. And also there are many different types of trauma. So a person might be, for example, in an abusive relationship, but they don't actually see that as traumatic, they just see that as normal. So it's not unusual for trauma symptoms to be missed in the diagnosis. So obviously this causes a lot of confusion and complexity with the person, and this is where therapy can help. So actually in the assessment, you can ask people what their symptoms are and ask some questions about any sort of traumatic experience they've had and how they feel about certain events. So that can bring more clarity and understanding for that person. And simply by having an explanation of what the problem is can really help that person to feel less confused and have a clearer idea of the plan of how they're going to get better. So simply actually going through it with an experienced therapist can really help to bring clarity and understanding to what the problems are, and also having clarity as to how to deal with them. Other problems with trauma are people often describe themselves as losing their old self, they're mourning their healthy self, or feeling more vulnerable as a result of experiencing a traumatic event. Other problems is that people's views can change of the world. So if they've had a traumatic event, they might not feel safe to go out into the world again, or if the trauma has involved other people, that may lose their trust in other people, and that might affect their relationships. So I said I want to talk to you about EMDR, and I now want to describe that in a bit more detail. So EMDR stands for eye movement desensitization reprocessing. Yes, it's a bit of a mouthful, isn't it? It is a therapy that is recommended by the NICE guidelines, which is basically the evidence-based part of the NHS, and it does actually have a lot of research evidence to support its effectiveness when coming to trauma. So actually EMDR can help in a number of problems. It's well known to treat trauma, but it also can help anxiety, depression, and addictions. So the therapy is structured, and its approach is to help people safely process traumatic memories or experiences in order to reduce these unpleasant symptoms. It can be really powerful to help people overcome their distress. So EMDR does have a lot of research into how effective it is. The research suggests that EMDR is just as effective as other therapies such as CBT in reducing trauma symptoms, and also research into that it improves the overall mental health of the person and helps to increase their quality of life. So if you go to see somebody like myself who's an EMDR therapist, what do you expect? So I would typically begin with an assessment of your problems, your history, and then to agree the best treatment plan for you. The next step will be testing of the EMDR techniques to ensure that you're comfortable with the process, you know what to expect, and you feel supported throughout. I normally start with encouraging EMDR using positive experiences, say, for example, visualizing a calm, relaxing place, which is designed to help you to feel more relaxed. I also think it's important that you know that you can stop at any time and that we're actually communicating while we're actually processing the events. So it's very important to say EMDR is not hypnotherapy. You are very much aware what's happening and you have control over the process. I think this is really important because people who experience trauma, it's a very distressing process, experiencing all the trauma and all the symptoms that go with it. So often I notice that people feel out of control. So actually in the therapy process, helping you to feel grounded and supported is very fundamental to feeling that you can actually cope with processing your traumas and feel better. And also it's really important to emphasize that the first experience of EMDR is reinforcing positive memories, positive sensations. So this is a good start to therapy. And actually you can always go back anytime in the therapy to these positive sensations and memories. And this actually can help you feel more reassured and in control. There's choices that you can actually make. So after that is all established and the person, you feel better about going to the next step, we then can decide on what specific memory or memories to work on. And then when you are ready, we would process the distressing memory. And EMDR can actually help with a whole range of symptoms, from distressing images, smells, sounds, unpleasant body sensations and beliefs. So a typical plan would to take something specific, say for example a distressing image, and to continue to process that So the image is either no longer there, or you don't feel distressed. The image might be there, but you have no emotional reaction to it. And that will be a good result for EMDR. And once the distressing memory has been processed, often more positive images or beliefs can emerge, which can actually help to get a different positive perspective on the situation. So you might ask, are there any downsides? So obviously one difficulty you have to remember is that you do have to focus on the distressing event in order to process it. But the way to help you with this is I can remind you that we are just working on a memory. You are actually safe right now. You can control it. You can come in and out of it if you want to. And it is simply a memory. So that's really important. And you also have to be open to the experience. Some people just try too hard. It works better if you just relax and see it's a natural way that our brains heal, and you're more likely to get results then. So I really hope that this will help you to understand it and to try it. So if you want any more information, you can go to my website, Wendyc.team, for more details. And you can always leave me a message via the website if you want to have a chat about EMDR or trauma or anything else you think EMDR can help you with, and I'll be more than happy to talk to you and help you. Nice talking to you, and I hope to hear from you soon. Bye-bye.